and welcome to Contraceptive Chat with DKT Nigeria. I'm sure you've been waiting to watch this program. We have been waiting to come on air as well. It's my greatest pleasure to be on and back again with you on the program. My name is Tom Twaki-Lawson Aderele, and I'm sure you know by now that DKT is an innovative marketing organization, of course, that deals with the prevention of HIV/AIDS and also with the prevention of unwanted pregnancy. It also places high premium on maternal health. Well, this program is brought to you by DKT Nigeria, and of course on this program what we discuss mainly is contraception, various means of contraception, the effects, when I say the effects, I mean the side effects, the benefits, how to manage these various means of contraception, and a whole lot of things. It's basically, maternal health, and prevention of HIV/AIDS. Today on the program, it's not really going to be much different. We're going to be discussing another method of contraception. I wouldn't let the cat out of the bag, at least not just yet. But what I'll just ask you to do is sit back, relax, and have fun. We'll take a break, and when we come back, I'll introduce my guests to you, and I'll tell you what we're going to be discussing. It's good to be here. You're welcome to the program. Welcome back to the program. Today we're going to be looking at the implant, and of course I have in the studio, unlike last week, I have two very beautiful women in the studio. But guess what? Dr. Laleye, as usual, is here. So Doctor, it's nice to have you on the program. Thank you for coming.
Thank you for having me.
All right, and I have somebody who's a very new face, the first time on the program, but I'm delighted to have her with us here today. It's my pleasure to introduce to you Maria Ocheja. Maria, thank you.
Thank you for having me. I'm welcome.
Yes, you are welcome. And I should have said this, that Maria is from DKT Nigeria. So we have Dr. Laleye and we have Maria, and you're in the best hands today. So we're going to be talking about the implants, and we're going to be asking them questions. They will answer all your questions. So just get ready. Stay by your telephone sets. Once we throw the lines open, you can send in, you can start to ask your questions. But in the meantime, again, I'd like to welcome both of you to the program.
Thank you.
Okay, today, Dr. Laleye, I'm going to ask you to please sit back a bit while I ask Maria the first question. So today we're talking about the implant, Maria. Now, can you tell us exactly what the implant is?
An implant is a much like, or if you may, a rod, flexible rod that is inserted in the upper non-dominant arm for the purpose of family planning or contraception. Now, in layman terms, what this means is that an implant is a flexible, very short rod, very tiny skin-soothing rod that you insert in the non-dominant arm. Your non-dominant arm is the arm that you do not use frequently. Now, if you're right-handed, it means that your non-dominant arm will be your left hand. If you're left-handed, that means your non-dominant arm will be your right hand. The implant contains a hormone that releases tiny dosage into the system to prevent pregnancy or for the purpose of family planning or contraception. Doctor will tell us what these hormones are.
Well, we're going to get to Doctor, but before I move to Doctor, you want to tell us, since you're from DKT, what is the DKT brand of the implant called?
Our implants, and there are two of them. There is one that is for 3 years. It is called Implanon NXT.
Okay.
And then we have Jadel. Implanon NXT is for 3 years and Jadel is for 5 years. Both are hormonal. That means they contain a given hormone that releases tiny dosage of the hormone into your system for pregnancy prevention.
Okay. So now we have to come back to doctor. You see, she now threw me back to, you see, I gave you the priority and I said, doctor, please sit aside, and then you now said, go back to doctor. So doctor, we're back to you now. Who can use the implant?
All right, thank you very much. Like she rightly explained, this method of contraceptive is an example of the hormonal method. And maybe I should just quickly mention the hormones.
Okay.
And she mentioned two variants, the Implanon NXT and the Jadel. The Jadel contains levonorgestrel, which is a type of progesterone hormone. And then the Implanon NXT has what is known as the ethanogestrel. So what these hormones do basically is that they prevent unwanted pregnancy by preventing ovulation from occurring. That's by preventing the woman from releasing the egg. And they also act on the cervical mucus. They make it thick such that spermatozoa does not easily move through it. So basically that's the mechanism of action. And then your question was who can use it? Okay, the average healthy woman, if you're looking to go on a method of contraception that is relatively long term, between 3 years to 5 years, if you are not the type of woman who will remember to take a pill every day, if you are the type of woman who may not necessarily want to take an injection every 3 months, then this is the method for you. And even if you're a breastfeeding mother, you can use this method as long as your baby is up to 6 weeks old. You can actually use this method.
Okay, so while I ask you who can use it, I'll also ask you who cannot use it.
Thank you very much. So coming to who cannot use it, basically this is a hormonal method like we rightly explained. So for those, most of the people who generally cannot use hormonal methods can also not use these methods. So for example, if you have a history of breast cancer, it is not advised that you take on this method. If you have a liver disease, whatever kind of liver disease at all, it's not recommended that you use this method. If you have a high blood pressure or an undiagnosed vaginal bleeding, you are not advised to use this method. So basically, in a nutshell, if you have liver disease, if you have high blood pressure, hypertension, or a hypertensive heart disease, if you have breast cancer or any of the other gynecological cancers, it's not advisable that you use this method.
Okay, so Maria, how is the implant used?
First and foremost, an implant is not it's not an emergency contraceptive like our brand of EC, that's the oral emergency contraceptive, the post pill. Yes, it's not an emergency contraceptive that you could just hop onto a pharmacy and obtain. No, you need to go to your healthcare provider. And let's put it out there that it's not any healthcare provider, like doctor has mentioned the categories of people that should and should not use. Now, there are, with very due respect to our healthcare practitioners, it's not every healthcare provider that is a specialist or that is trained on family planning or contraceptive methods. So please go to a healthcare provider that is trained to insert, because they need to do some checks on you. If you go to a trained healthcare provider or a specialist on this, they would check your system, ask you some questions. Do you smoke? Have you noticed any abnormalities in your body? And most times, please, for those of you listening to us, if you go to your healthcare providers, especially the medical ones who are trained in this field, please be open to them. Always tell them the
everything.
truth. So tell them everything, because some women, they'll ask them, do you smoke? They'll say, no, doctor, I've never held a stick in my life. There's no need for that, because the doctor will not go and start gossiping about his friends. No, that's why we said trained. That's one. If you get there, he would what's the question? The question is
okay, I'll take a history.
Yes. Thank you. Sorry, I'm not a medical doctor. So the doctor will ask you that. Then aside from that, the doctor would also, after the system check, the doctor would tell you maybe if you are in the right frame of mind to receive, because it's really not painful, because some people think that, oh, it's very hurtful, I'm going to bleed for days. No, you just lay back, possibly on the bed, and then they insert it for you. And please don't forget, the implants from DKT is either Jadel or implant on NXT. It depends on what you want to do. If you want to space children, if you don't want to take in, that is if you don't want to get pregnant during a given or a particular period of time, or if you, I don't know, if you just do not want to get pregnant, implants are the best things for you. And there are people that do not like regular checks. They don't want to, oh, let me go to the hospital today. Is he working? Is not working? No, they do not want regular checks. Then the implants are your best.
I mean, it gives you a while.
3 to 5 years.
Okay, so while we're at that, I think we should throw the lines open because I know some of you are itching to be part of this program. We really want you to call. We want to hear from you. So the number to call is 0908 729 6673. I'll take that once more. 0908 729 6673. Please call us and let's hear from you. We have the experts sitting here and they'll answer all your questions. Okay, so doctor, we're coming back to you now. Now, what are the benefits of using the implant? And when I say the implant, now I'm talking about both products.
Yeah, definitely. Thank you very much. I particularly happen to like this method very much because it's one of the most reliable methods of contraceptive, and research has shown that the failure rate with this method is just about 0.05%. So this method is actually about 99.9% reliable. I mean, what more
can you ask
do you want? Yeah. So if you are the type of person who is actually really skeptical, do these methods really, are they really able to prevent pregnancies, and you are physically fit, you do not have any of those medical conditions I mentioned, this is the method of choice, because with this method you can relax. So one of the very important benefits is the fact that it is a very reliable method, and another benefit is the fact that, of course, it can prevent pregnancy for up to 3 to 5 years. That's long term, depending on what you want. And another beautiful benefit of this method is the fact that there is quick return to fertility. Once the woman says, okay, I think I'm ready now to start bearing children, you only need to visit your clinic, and then your healthcare professional takes it out. Immediately it is taken out, the effect wears off. There's nothing like, okay, you need to wait for a period of 3 to 6 months for fertility to return. No, with this method, that does not happen. Another benefit of this method is the fact that it starts to work immediately it is inserted. So you do not need to bother about using a secondary method of protection maybe within the first 7 days like we usually do for the daily pill and all. So it starts working immediately it is inserted. You can remove it at any time you want, and there's quick return to fertility. It is very reliable, and it's able to prevent pregnancy for a long period of time, over 3 to 5 years, depending on which method you adopt.
Okay, well, I'm sure that everything that has a benefit, probably has a side effect. So we will be looking at the side effects, but I wonder why the calls are not coming in. Please call us. We're expecting to hear from you. The number to call is 0908 729 6673. The number is being displayed on the screen, so you just look out there and please reach us as soon as possible. Okay, so let's look at some of the side effects of the implant.
Okay, before we exhaust the side effects,
you want to add to what you said?
No, not to add, but before we cross that bridge, that's what I'm trying to say. So usually if you buy, many of us, if we buy drugs, like I won't lie, personally, if I buy drugs, I don't buy paracetamol and then start reading leaflets. But I think over time, experience has opened my eyes. Some doctor friends that I have would often tell me, if you buy whatever medicine it is, even if it's a malaria medicine, always look at the leaflets or the body of the medication for side effects. Now, there is no great thing without side effects. Even what I heard these days has side effects. But anyways, the side effects for these implants include headache, nausea, and in some cases vomiting, breast tenderness. Then some people, there's this dizziness. Those are the most common. These 4 I have mentioned are the most common side effects. Then minimal, this is the one I know many ladies do not like to hear. Very minimal weight gain. And by weight gain I mean you can add like 10 pounds or 5 pounds. It's not even up to a kg. It's just very
inconsequential.
It's inconsequential. And you know, doctor and Maria are not the same people.
That's correct.
What can apply to doctor or what could apply to you, ma, might definitely be different from me. I might gain weight, you might not gain an ounce, you might not gain anything. She might gain, and then I might gain 10 kg. It's just different, but it doesn't get to that extent, or it's not that bad. But they can all be managed. I've met people that would they'll eat breakfast, 2 plates of eba, eat lunch, pounded yam, and eat rice for dinner.
And then when they deal with it, they blame the contraceptive.
They'll blame the contraceptive. No, ma, you are wrong. So what's going into your mouth? What's your ingestion like? What's going into here? So you have to watch that. Then for something like headache, you can take a painkiller or any pain relief tablet. In a matter of, some people, in a matter of days. My boss that comes here, Madam Lara, her own didn't give her any problems. She's always on this show, you know her. So it didn't give her any of those, side effects. So it's really different. That is why we say go to a trained
Healthcare
expert, trained medical professional, and it's not just anybody. There are some people that are medical doctors, quite alright, but they do not have the training in the family planning, contraceptive line. So it needs to be a trained, and please, as a receiver, as the client who is getting the implants, for example, one of my co-workers at the office just recently told me that when she was on the field, before she got back into the office, some of these women, when they're on outreaches, they'll just say, Madam, put this for me. Maybe because we're friends, you've told me, Maria, I'm using Implanon NXT, it has never given me headache. See, you are giving birth to 6 children in 2 years, better go and get it now. And the next thing, I just meet a doctor, put this for me. Just like that? No. So there's a step, there's a gradual process, a very easy gradual process that you would follow. Oh, okay, check my system. Do you smoke? No, I don't smoke. Or do you smoke? Oh, yes, I smoke. Or instead, just use Levofem. Just be using Levofem for now, and let's watch you. Let's see how you do. So that's just it. The side effects are very minimal. And can be managed.
Okay, so doctor, the implant is not an over-the-counter thing.
Definitely not.
I mean, so I mean, just like Maria was saying that, I want to do like a little X-ray, look deeper into it. Since it's not an over-the-counter thing, it can be purchased. Therefore, it says that you have to see a healthcare provider to get one. And if you do that, then can you go wrong?
No, I don't think so. But well, okay. I actually wanted to add to the side effects before we.
So some of the side effects, okay.
Yeah, because this one is what will worry most women, and that's menstrual irregularity. So if you're on this method and you find that you're not bleeding as much as you used to, or you are bleeding much more than you used to, or it's not even coming at all, you don't need to worry. Please relax. It's perfectly normal. Like she rightly explained, some women will have these side effects and some women will not. So if you belong to the class of women who do, you don't need to worry. It's perfectly normal. In fact, I know people who are on this method and are actually happy. They don't need to wear a pad anytime. The thing doesn't come and they're okay. But some other women believe that the bad blood is going somewhere. The bad blood is not getting stored up anyway. Because part of the mechanism of action is that this method can actually thin the inner lining of the womb, and so when there's no lining, there's nothing to shed. So that is why you have reduced menstrual flow. So you really do not need to worry if the flow is not coming. And definitely, like she said, it's not an over-the-counter thing.
Yes.
You need to see your health care. Even if someone gives you one for free, you will probably not be able to insert it yourself because it's going under your skin. You're not likely going to be able to put it in yourself. So please, you need to see your healthcare expert to put it in. And much more importantly, they need to take a history.
I guess we have a call on the line. Hello.
Good afternoon.
Good afternoon. What's your name? Where are you calling from?
I'm Temi Tokwe.
Temi Tokwe. Yeah, where are you calling from?
Yeah.
Temi Tokwe?
From Ketu.
From Ketu. Yeah, go ahead and ask a question.
Okay, I want to ask about
Oh my God, we lost that. We lost that call. Well, the number is being displayed on the screen. Please, look at the number and reach out to us. We're waiting to hear your questions and give you appropriate answers to those questions. But where I was trying to get to, Doctor, is that when I said you can't go wrong is if a healthcare provider, proper healthcare, trained healthcare provider is putting the implant for you, then of course he will tell you the do's and don'ts, how to manage, how to maintain, and all of that. That's why I said that you cannot go, you're not likely to go wrong. And I don't think the rate of abuse will be really high. What do you think, Maria, of the implants?
I don't think there will be
abuse. They can't be.
There is almost no way it can be abused.
Okay, let's look at, hello?
Hello, good afternoon.
Good afternoon. Welcome to the program. What's your name?
I just need to ask a question about a man. Can a man ask you a question?
Oh, why not?
So please, you talk something about dizziness or so.
About?
If a man always experience dizziness, what can be the cause of this?
No, okay, let me quickly tell you, you didn't listen, you weren't watching the program. It's a program about contraceptives and contraception. So dizziness was one of the side effects of the particular contraceptive we're talking about. Okay? So it's not about a general thing. So maybe you should just listen a little more and then you'll understand where we're coming from. Thank you for calling on the program. Thank you so much. All right, the lines are open. Please call us and let us know what you're thinking or what you need to know.
Okay, well, if I may just try to answer his question, even though it has nothing to do with contraceptive. He said if a man has dizziness, the truth about the matter is that there are like 1,001 reasons why you may feel dizzy. So I would advise you see your doctor. They will take a history and conduct test to know what the problem is.
Hello, good afternoon. Welcome to the program.
Good afternoon.
Well, you need to do something for me. Can you turn down the volume of your TV set, please? Okay, now this is a subtle appeal. If you want to be part of this program, we want to listen and hear from you. But we'll ask you to turn down the volume of your television set so that we can hear you and you can hear us. Okay, so you want to call us, please turn down the volume of your television set so that you don't have a callback or an echo, and then we can hear you that way. Okay, doctor, you were telling us, adding to some of the side effects you spoke about.
Okay, yeah, I just really wanted to expatiate on the menstrual flow because that worries a lot of women. And most of the time we get calls, okay, I started this method 2 months ago, I'm not seeing my period, hope that is okay. I would just like to reiterate, it is very okay. It's one of the side effects of this particular method. And if you are the type of woman who is bothered about not seeing her menstrual flow, then maybe this is not the method for you. You can choose from the various other methods available.
From the stable of DKT,
yes,
let me emphasize.
Yes.
Baskets of products.
And we have a lot. We really have a lot that are equally very reliable and very suitable for a lot of women.
I guess we have a call on the line. Hello, good afternoon.
Yeah, good afternoon.
What's your name, sir, and where are you calling from?
My name is Solomon.
Okay, Solomon, go ahead and ask your question.
Yeah. I'm calling from Lagos.
Okay, ask your question.
I want to ask if a woman, maybe somebody that stay in a husband house for 5 years, what is the problem?
Okay.
Okay, without
an issue. Okay, thank you, Solomon, for calling. Doctor will answer your question. Just listening. Thank you so much. Okay, so woman's married for 5 years, she doesn't have a child.
And has
what could be the possible cause?
Okay, well, there are of course very many reasons which are not limited to the woman alone. Of course, a couple has been married for 5 years, no children, that is a pure case of infertility, and we refer to that as primary infertility. Primary because they've never had any issue. Well, I wouldn't know if she has ever been pregnant and probably lost the pregnancies along the way, so I'm just going to assume that she's never taken it. So that is primary infertility. And for infertility there are various factors. There are some factors relating to the woman. We have female factors and we also have male factors. So you will need to both see a gynecologist. They will take your history, examine you, the man, examine the woman, send you for various tests to get to the bottom of the problem, and then treatment can begin.
Hello? Hello?
Hello.
Hello, good afternoon. Welcome to the program. What's your name and where are you calling from? Where are you calling from? What's your name, sir? Hello?
Hello.
Hello, we can hear you. Well, I think we need to cut that call, and that's why I said you need to turn down the volume of your television set, please.
Hello.
I don't think we can take that call.
Hello.
We can't take it. Okay, so that's it. Okay, so doctor, let me ask Maria this time. I'm sure you know there are lots of myths and facts surrounding, various forms of contraception. But since we're looking at the implant, can you tell us some of the myths? And the doctor will tell us some of the facts very quickly because we have like a minute left.
Okay, some of the myths include that it takes a very long return to fertility, and when I say long, there are exaggerated ages that I've heard, unbelievably exaggerated, like 10 years, 11 years. As doctor said before.
Let's go quickly. Hello, I can hear you. What's your name? Hello?
Hello.
I can hear you. What's your name, sir? Okay, yes, so Maria.
Some of the myths include return to fertility is not immediate, which is false. Another myth includes when you have an implant, you might not be able to take in, especially if it's going to be a second issue. Like in the north where I stay and where I'm from, the myths are uncountable. They don't stop. I think somebody just, maybe when she's turning her toe, she just says, oh, okay, yeah, this can be a myth. And
that's it.
There are no more myths anymore. They're becoming lies now. So anyways, that's another one. Then another one is that your body might swallow it up. It might get missing in your body. And it's not true.
We don't have time.
Then another one is that when they're putting it, if they put it, the place would an injury, like you'll be injured or scarred for life. And
okay,
it's not
I think that's really enough. Can you just summarize, because we are in our society?
All right, actually, she also debunked all the myths as she mentioned them, so I think we're fine. Yeah.
Well, one thing I noticed today is that we had all male callers, and I like to say kudos to the men. I mean, that you're listening, is encouraging to us. I'd like to thank my guests for coming on the program. Maria, thank you for being a first time on the program and coming all the way from the north. We really appreciate that. Thank you. God bless you. Dr. Lale, it's you and I forever.
Always my pleasure.
Thank you. And thank you so much for watching the program. We hope you'll do this again, same time and same station next week. By the grace of God, we will be back next week with a brand new topic from DKT. Until then, have yourselves a wonderful week through, and I'll see you next week. God bless you.